thanks, Mohanji, because somewhere we were bred in the family. Most of us know that I have a mic मिलता है तो श्री को बॉस श्री नागेश गाना शुरू हो जाता है. But this particular thing we had idea was to get all of us under one roof. And there was a big thing, Hyderabad people don't do any conference. We always used to tell, so we just thought we were doing partly, but somewhere. But I had one intention. Everything is a long format game. Shrini, I was telling you, every was a 5 test day match. तो थोड़ा boring हो जाता है. तो this format is Shri, it is purely on the T20 match. Every speaker, we are not trying to debate here. This is purely a discussion, so there are no debates, right? Let us be on very this one, because all of us have got something which we try to be a USP. Ramesh, you have something which I can't do it. So let us try to, the way the things have been going out as a medical doctor, it's always a challenge, I believe, because this is one thing. Almost all the things have going slightly out of control, particularly in chronic disease management. Chronic disease management and to be healthy, there are big things. And my family, my dad and mother, were so clear about that. They gave me two or three commandments. One is, welcome Dr. Chandrakant. The 2-3 commandments were like that. One is, you should not smoke. And the other thing is, you should not take alcohol. And the third one they gave was a really interesting thing. They said, you sleep at time and get up at time. Okay, but these two commandments, we used to always think about that. If I tell my son is a third year MBBS exam going back person, so if I tell that, okay, these two commandments are enough, any of us have to, what are the things which we are going to give it to our new generation? What are the challenges ahead? So I start working from looking at the way things, क्या चल रहा है इंडिया में चल क्या रहा है, फॉक चल रहा है, right? The generation which is coming from that thing, they are talking about, this is one thing, which is, so we have to slowly inculcate some habits. Good food, everything is a good things, but what are the deadly toxins? What are the things which you are exposed? Like it comes out of the blue actually. We have seen people right now here also. There is something called as a elephant in the room, and we are not able to see that. We are supposed to understand that and try to work it out. We have a good carpet. I don't know when this carpet was clean and all that. We have reasons to say carpet is, it outgases a lot of toxic fumes and all that. Right from the day you start your thing, I don't go with the shampoo and all that, but still everything has to be taken. The person who is interested not to get into a disease, it's really challenge. And we see, Murthy, it is something like that. I see only really 10% of the people having with the silver spoon. They have a good health, robust health. My professor used to have everything. He was a pediatric professor, he was a top guy with height and all that. And during conferences, he used to have a full bottle. And the next day, he's very active. So I don't think the present generation, what is now, they are bombarded with a lot of toxins, lot of stuff. We have so many things. We need to start looking at all that stuff. So we started telling about what are the 10 commandments you'd like to give. Everyone can always add up things and all that. We talk about plastic, we talk about nasty chemicals from your lipstick, everything kind of stuff. But how these small things are making a difference, we'll try to see in our subsequent sessions and all that. The huge rise of something like autoimmune disease. And autoimmune disease is one thing which we have devoted a separate discussion. We have a panel, people are going to talk about that. I definitely would like to take up questions and all that, but we'll just do one thing. We'll just write, if you have any relevant question on that, just write on a piece of paper and try to give it to the, so we'll handle that during other time. And I can always tell you, everyone who is going to speak here has got something to give. And let us hear them in the sense. Thing is, like, what happens is that somewhere we had, there is no repetitions going to be here. Repetition, I'm the worst guy, I keep repeating the things and all that. But somewhere, this is all the people who are going to talk. Like Sanjeev is talking about integrative psychiatry, something which is very, very unique. And similarly, like that with other speakers and all that. So we have divided into different silos. One is autoimmune disease, second one is oncology, integrative oncology. We have, there are number of the other speakers are also going to come, and we are trying to see what the other person can do with that. Now that it is something which I believe as a kind of thing is, we need to integrate here. We started work a concept of integrative medicine just because that we, as if I'm an allopath, I'm just doing some or whatever interventions I'm doing, I'm not able to work out totally here. I need to take the help of the other person also. Other person can be a dentist, because without that oral health, we cannot go further. We can be a Ayurvedic specialist, it can be a homeopath, because we have, everyone has got some great stuff. Srikant Babu is here, he always keeps coming on the TV and all that. I'm slightly, like, think, the work he has done, let us hear from here. What the work is being done by Dr. Malaysia, ozone, getting ozone into that, Karthik, working on autoimmune diseases. There are so many people who are, so let us try to pull up together. And my intention is again and again trying to work it out, taking this to you need to take it to the policymakers. So policymakers, how we can go, if I go individually, I'll not be anything. So we need to form a group, and we came up with the idea, okay, basically we all sitting here, this is the first step we have taken, it's a great commendable thing. We all are physicians for social responsibility. We'll try to think about the society, and we are not affiliated with any big things and all that. We want our patients smile on our patients' faces. I know each and every one of you, you people work so diligently, and let us try to take up in a big way and try to work on that. So thing is, we will try to start with our autoimmune panel, and I would like to invite